Hello everyone, my name is Caleb Jones and I have cystic fibrosis, diabetes, flat feet, good looks, and bad eyesight. And today I'm going to do my first video on running. I can tell you that running has had the most beneficial effect on my cystic fibrosis. It is a way to clear my airways. It is a way to just feel better in general. It's a way to push your limits so that you can know what your limits are. You won't be able to know it unless you try. You won't be able to know how far you can run or if you run unless you try. And I can tell you that problems with coughing, problems with being tired, problems with not getting enough air, problems with feeling like you're breathing out of a straw, problems with all of those things are things that people without cystic fibrosis struggle with when they run. Now those can be a little bit more accented if you have cystic fibrosis, but that's okay. It's also going to help you more than anybody who doesn't have cystic fibrosis. Diabetes is a complicating factor for me. I can't really get into the general know-how of how to do that. That's going to be a lot more lengthy video. That's going to be a lot more. But I can tell you that we're going to get to that. This right now is just going to be some of the general stuff of how you do it, why you do it, what it's going to look like. So let's just cover some of those things right now and what we can do. Alright guys, this next thing is pretty important. It is pretty important to you if you have diabetes. If you have cystic fibrosis only, or if you're going to be running on a treadmill, or if you're going to be running very short distances for a very short time, this is not really a concern. But if you do have diabetes, and if you are going to be running for long distances, or if you're even just going to be doing something like walking, if you're going to be doing it for a long time, you're going to need to take things with you. The way you do that is with a running belt. I have searched far and wide for good running belts. So for instance, we have this Camelback one that I thought was going to be wonderful. It's got this gigantic water bottle on the side which hits by your hip, and this wonderful bouncy little bag in the back. This is terrible. It's terrible. Don't buy this. It's bad. It bounces. You're not going to like it. Don't go for it. I found two that kind of worked for me. This first one was an amphipod. It's it's got an elastic waistband, and you can kind of buy these extra things to clip on. It's got this main pocket. That one worked for me. The other one that, for me at least, is working better is kind of this Nathan one. They both don't bounce very much when you're running, and so you can carry things in it without being annoying. But I think as I use this one a little bit more, the stretchy part is becoming more stretchy, and so it's starting to bounce a lot more. But then again, on the other hand, this Nathan is pretty tight, and so if it doesn't fit you right, this one fits me pretty well. If it doesn't fit you right, you might want to go back with this one. The reason that these two are the good ones is that you can fit the things that you need to take. And so I'm about to tell you what you need to take. You're going to need three main things. You're going to need your glucometer, you're going to need your pump, and you're going to need food. Your glucometer is going to tell you what your blood sugar is when you're in the middle of a workout and you feel bad. Your pump is going to be able to correct you down, and your food is going to be able to correct you up. So what I usually do is I get a plastic bag. You need the meter itself, put it in. You're going to need the gun itself because you're going to have to bleed. If you want, you can take some alcohol swabs or something like that. And also, depending on, I can fit the entire container into that one. If not, just take 3 or 4 or 5 and put it in the bag. At this point, you've got your pump taken care of, or your glucometer taken care of. That's one. Your pump, wrap it up. I do not run connected to my pump. Your insulin is hyperactively efficient whenever you're running, and so even if you do have to correct down, you do not need to correct down in the same way you would if you were just walking about. Those are your main things. Also, as far as food goes, I like GOO energy gels. They've got 22 grams of carbs, so that's a pretty nice even kind of dose that you would like to have. They're much better than sugar pills. This has got 22 grams of carbs, but only 6 grams of sugar, and so it's got something that'll carry you through. They're much better than the sugar pills when you're running, which honestly, they just don't affect my blood sugar at all when I'm down and I need to come up and I'm exercising. Exercise does not work well with me with sugar pills. So whenever you have those, pack them in, do whatever you can. This Nathan actually holds a lot more stuff in there. It actually holds a little bit more than this, and it's just as good. So once you've got it up there, take it, wrap it around you, you're set to go. Something else I want to talk about is water. As you'll see later in this video, we are going to use water. Water can be useful even if you've only got CF. But if you want to manage your diabetes, if you got 2 water bottles, one with Gatorade in it and one with water, I will tell you, empty out the Gatorade whenever you finish, because whichever water bottle has Gatorade will mold if you leave the Gatorade in there or if you don't wash the excess Gatorade out whenever you're done with it. So that's pretty much what you're going to have if you want to manage your diabetes on your run. The longer you go, the more you will need it. When I was also a young man, I could get away with this stuff. I didn't need it. But now that I'm kind of getting old, like, well, I'm 29, and so I kind of have to start watching it a lot more. Additional things, once I said, sweat can be your enemy, especially in the summertime. So if you need to check, you need to wipe off your hands, you can just wrap that around everywhere. You can, honestly, you can tie it around your forehead, just so long as that'll get sweat off. And another thing that I can recommend, I bought a medical ID bracelet, which you can definitely have too. That's just kind of your emergency situations. But look for those, and that'll get you going on your run. A good general rule for running is that you should, if you're trying to build endurance and go far, start off slower than feels comfortable, because eventually you'll wish you had gone slower at the end. It's better to end fast than start fast and end slow. Your endurance is going to be shown in how far you can keep going the same pace and speed up the end. If you can run and talk, you're going about the right speed. If you can run and sing, you're going too slow. If you can't talk when you run, you need to slow it down. Get yourself a good pace. I'm currently running up a hill right now. It's almost difficult to talk. Come back when I'm at the top. It is generally not a good thing to stop in the middle of your run, like I am, to tie my shoe. It's gonna not build endurance. But if you have to, in order to get something straight, cough up, clear some mucus, it doesn't matter. Do what you can. Get back on the road. I'll tell you, one of the biggest reasons that I have to stop is coughing up blood. And coughing up blood just happens. Depends on where you are and how healthy you are. But I've found personally that there are 2 types of coughing up blood. The first type is just streaks and mucus. Not too bad. You can handle that just like you can handle mucus. You should be able to learn how to, excuse me, cough and run at the same time. The hard part is when you just get straight blood. For me, I feel a little pop, a little snap, something in my lung, and it feels like drops of liquid, which it is. And I start coughing uncontrollably, and the thing you spit out is not clear, it's not green, it's straight red. I get it whenever I've exerted myself too quickly, sometimes when I swim, sometimes when I'm, sick on my own, sometimes when I'm just not in the best shape or something like that. It's definitely when it's more frequent, but there's nothing to really pin it all down. It can happen at any time, but whenever that happens, you definitely got to stop. You definitely got to slow down, take deep breaths, let that bleeding stop in your lungs, and then take it easy from there. I have not found a way to really overcome that part in a hard workout. If you get blood from your lungs, you're not going to be going hard. You might be able to jog slowly, but unfortunately, you might be done in for that day. Hi guys, I'd like to cover another thing. Now, as most people with CF already know, there can be certain bowel issues that accompany the disease to varying degrees in some form or another. Fortunately, a little-known benefit of regular exercise like running, I found, is that it brings a certain order and regularity to where at one point it did not exist. The bad news is that it achieves that order and regularity by being a natural diuretic. Whenever you run, your body has an innate tendency to want to expel all extra weight that it can. That means that your runs could produce other runs. Your explosive speed could create certain explosive needs. That means you probably need to plan ahead before you go. If you're starting out, probably run in a gym on a treadmill so that there's always a bathroom nearby. Or if you're going to run outside in the great outdoors, make sure that there's some pit stop somewhere that you can go to if you really need to. Or if that's not an option, I recommend going out into the wilderness to where there's no one there to care. Because I'll tell you what, if you don't plan ahead, you could ruin a good workout or a good pair of shorts. All right. 3/4 done with my run. Blood sugar's 93, kind of low for what I want it to be. At this point is when I pull out the food that I carry with me. Take it in, eat it, recharge on the go. Delicious. Goo energy packs. Do it. Woo! All right, guys. It's the end of the workout. And for me, whenever I finish, that's when the coughing really starts. Your lungs somehow figure it out. You stopped running, and that's when you clear out. Now, as is very common with me, I cough so much that I throw up. And if that happens to you, I'll tell you, sometimes it's very difficult to stop throwing up. And so in that case, that's why I like to have a little water with me. The key is to take very small swallows. That gets your esophagus used to things going down instead of coming up. Whew. Whew. Well, that's a treatment for you.